We are an option for long-term care. So individuals, most folks want to remain in their home for as long as possible, and they want to age in place. And we are able to, our program and our services are able to help them do that, remain their independence for as long as possible and as safely as possible in their choice of environment. So my name is Werner. I'm the director of the Reid Health PACE program. My background is I have a master's of geriatrics from the University of Indianapolis. And I come from Medicaid waiver and home care. That's my background. So my passion is aging in place. I'm a firm believer in that, and anything that I could do. Wayne County is my home. I was born and raised here, and was hoping that Reid would just open a program for geriatrics that I could join, and I'm very excited to be a part of that program. So this is home, and so I get to serve my home, my family members, my friends, so we're excited to do that.
Hi, I'm Sharrie Harlin-Davis, and welcome to this episode of Reid Beside You. Our guest today is Jason Woods, the Community Liaison with the PACE Center. And Jason, welcome to Reid Beside You.
Thank you so much. Glad to be here.
And actually, the PACE Center has been so, for the west side of Richmond, has been so anticipated.
Yes.
So a lot of people want to know exactly what's going on in the building. And so tell me exactly what is PACE?
So PACE is still a relatively new program. It stands for Program of All-Inclusive Care for the Elderly. It did start back in 1971, but it wasn't really until the 80s and actually the latter part of the 90s that it started really replicating across the United States. Today it's still only in 31 states, and here in the state of Indiana, Reid will be only the third provider of the PACE program. But the program itself is designed to incorporate and to integrate services needed for the aging population, bring them together, and bring a concept called the interdisciplinary team, bring all that together so we can ensure that we bring all of the services needed to serve that population.
And this is actually a part of Medicare and Medicaid?
Yes. In 1997, I believe it was written into both Medicare and Medicaid, and that is our main funding source for this program. So we work with CMS, the Centers for Medicare and Medicaid, but also if somebody doesn't have Medicare or Medicaid, they can still become a participant of PACE. So it can be done through private pay as well.
Okay. So you've explained what the actual PACE program is, but tell us about the PACE Center.
All right, the PACE Center here is, so across the United States there's many different PACE centers, but no two PACE centers are alike. Reid, when they signed on to do the PACE program for this area, they acquired this beautiful facility, and they really went above and beyond in the remodel of it, and they added so much to it. So here at our PACE Center, here it's located here in Richmond, but we do serve 6 different counties. But the aspects of it, we have a full clinic that is, we have 5 different exam rooms, with one of them completely dedicated to telehealth, which is a service, especially through all of this COVID-19 stuff. It's a service that's only going to grow. So we are very happy to be able to have telehealth capabilities here. We also have triage. We also have labs here on site. We're one of the few PACE centers in the United States that actually have their own lab on site, so we're very proud of that. And then the other aspects of the PACE Center includes the room that we're sitting in right now, the day center, and this is really the heart of the center. This is where most of the activity will take place. So individuals, we call them participants in the PACE world. Participants, they will spend most of their day here at the PACE Center, depending on when they come and all of that. But it'll be right here in the day center. They'll serve meals here in the day center. We'll do different activities. We have a beautiful set of standing tables that can accommodate different individuals depending on if they're wheelchair bound or simply if they just want to stand up to do their activities. And then also we have a therapy area to our building. So we provide occupational and physical therapy here on site as well.
So what are some of the requirements to be eligible to come to the PACE Center?
So in PACE, they have I don't want to say strict, but we do have certain guidelines that we have to follow. So an individual has to be 55 years or older. They have to meet a nursing facility level of care. And when a lot of people hear that, they're not quite sure, is that me or not? We have a wonderful enrollment specialist. Her name is Krista Gibson. She will walk them through that process to verify whether or not they do meet that nursing facility level of care. They have to live within our service area, so the 6 counties. We do serve Randolph, Henry, Wayne, Fayette, Franklin, and Union counties.
Okay.
So they have to live within our service area. And then the last part of it, and it's very, very important, they have to be able to live safely in the community while utilizing our services here at PACE. So when they go through the enrollment process, we will look at what their needs are, and if we deem that even with PACE services, they won't be able to live safely in the community, then we won't be able to enroll them. But we will help coordinate and get them the services that they need.
When you're saying that, the easiest way I've been able to explain that is people that they don't actually live at a nursing home. They have to live on their own at home.
So we will actually be able to, I would imagine there's plenty of individuals that are currently residing in a nursing facility or a long-term facility. If they are somebody that could otherwise live in their own environment, if they were to utilize the PACE program, then we will work with that family to try to get them to the point where we can get them enrolled into the PACE program. So generally though, these are the participants that we serve. There are a lot of people that have just come to that point where they are looking at having to go into a long-term care facility, but we want to we want them to check with us because it's better for them if they can stay in their own environment.
Well, it's providing a sense of independence, I'd say.
Yes, our tagline here is supporting senior independence, and that is our true mission here at PACE. We really want to help them stay independent for as long as possible.
The average person at PACE, well, I know that you would have to be at least 55, but what are some of the figures that you've seen that the average age of a participant is?
So the average participant is generally in their mid to later 70s. So it's those individuals that are really starting to experience some chronic conditions that is forcing them to look at having to live into a long-term facility.
Okay.
The majority of PACE participants across the United States deal with things such as dementia. That's the #1 diagnosis among participants in PACE. So that's something that we want to help with as well. And generally it's females. We all know generally females outlive us males.
Yeah.
And that's the same in the PACE world. We do see a lot more females than we do males.
And people that have more chronic problems, they're able to come to the PACE clinic as well?
Yes, so when they go through the enrollment process, and it is a little bit of an extensive process itself, but they go through different assessments. So we want to really make sure that they are going to be the right candidate for PACE, because here at PACE, we want individuals to participate in our program, but we want the right individuals. We never want to put somebody in an unsafe environment or anything like that for them. So we will do the evaluations. We will look at whether or not they are a right candidate for PACE. They will go through those evaluations. And yeah, they can have chronic conditions, but as long as they're able to live safely in the community while utilizing our services, they can definitely be a participant of PACE.
I'm looking at some of the other, as I was researching, that was saying that many caregivers highly recommend PACE to someone in their situation. What's an average day?
So an average day, I wish I could really tell you what an average day for a participant is.
Is there such a thing?
Yeah, so the thing about the PACE program is it's tailored to the individual.
Okay.
So everybody that comes through the PACE program, all the different assessments that they do and things like that, out of that comes what's called an individualized care plan. So one participant may be coming to the day center 1 day a week for a few hours, or they could be coming 5 days a week all day.
So it's not just one size fits all?
No, it's not. It is truly a tailored program for the individual. And we'll also have some that won't even come to the day center whatsoever, because we will not only serve mobile individuals, but we can serve strictly homebound individuals as well.
And how does that work?
So we utilize home care services. Our professionals can go to the home, occupational and physical therapy. They can go and do services within the home as well. So we try to meet the individuals where they're able to meet at. So if they can come to our center, that's great. We want them here. But if they are homebound, we will definitely take services to them as well.
So no one's left out?
Nobody is. Nope.
That's great. On average, it says states pay PACE programs when they're working with Medicaid services a lot when it comes to the cost of care for comparable populations. So it seems that coming to the PACE Center actually can attribute good positives for their health.
Yeah, it can be great for their health. On the state side, it actually is shown to save the states, saves individual states a whole lot of money, because what's great about the PACE program is there's so many individuals that make up the interdisciplinary team. It's made up of 11 individuals, but it's not just them. There's other aspects, there's other people of the PACE Center that keep eyes on them. So we're able to catch things a whole lot sooner as they develop, and if we're not able to head them off, then we are able to treat them much quicker. So we've been able to cut down on unnecessary hospitalizations, the amount of time that they do stay in the hospital, different things like that, because we have a whole team of individuals working with the participant rather than them just working with one primary care physician.
And I know we have slides as well that will show, but on the interdisciplinary team. So can you give me some examples of who's on that team?
So it's made up of 11 different professionals and paraprofessionals, and it's everybody from a dietitian to our transportation coordinator to our nurse practitioner that we have here on staff, which I want to talk about them just for a second. We have Melissa Gallagher. She's a nurse practitioner. She's been with Reid for many years. We're very, very pleased to have her on hand. But also we have Dr. Patrick Anderson. He has come on board as our medical director.
And a lot of people know Dr. Anderson.
Yes, very much. We've already had several calls of people that have traced him to our PACE Center. So, but he's been in this area for 30 plus years. Very well respected, a great individual, very knowledgeable. So we're very happy to have him on board. But he'll be in those interdisciplinary team meetings as well, as he's available to. But there's nurses in there. We have a master's level social worker. There's just so many different people that make up that team, and they come together. They look at the profile of the individual, and they want to make sure that we are meeting all of the healthcare needs that individual has. And what's great about the PACE program is it's not just the interdisciplinary team that dictates services to the individual. We ask that the participant takes a little bit of charge in their health plan. We want to hear their opinions. We want to know what it is that they want to see out of receiving their health care. So all of those opinions are taken to the interdisciplinary team, and the participant is truly heard here. So I absolutely love that, because like I said, it's not us saying you need this, this, and this, and that's it. We want to hear from the participant as well, and we want to be able to meet their needs.
Before we touch on the enrollment process, I'm just amazed at within just more of this activity hub, the various things that people could see, and we'll see that as we have like a little tour later on.
It's a beautiful facility. I mean, just off of this main room right here, we have a beautiful television room. We have our occupational and physical therapy off to this side. We have a beautiful kitchen back there, and then right over here behind us, we have what's called a quiet room. And it's beautiful as well, very relaxing. It's for those individuals that, honestly, if they need to take a nap, if they're here during the day and they need to take a nap, they'll be able to do so. Or, if somebody becomes overstimulated, whatever the case may be, we have a nice quiet area for them to go to. So Reid has done really an amazing job when they sat down and planned the center out.
We before everything was closed, we had an opportunity to have you had an open house.
Yes.
And from some of my coworkers, they were sharing how much they enjoyed it. They also shared that this was the place for them. They said, snacks, crafts, I can take a nap. This is the place for me. So
us as employees are very much looking forward to when it opens as well, because I think we'll be partaking in some of that as well.
Definitely. So let's just go over the enrollment process.
Okay. So the enrollment process, I wish I could say it's real quick, easy, give us a call and then the next day you're signed up for PACE. However, it is a little bit more extensive than that, and we try to be upfront with individuals about that. Because there's many different parts of it. As I stated before, we really want to make sure that the individual is right for the program. So with that, there's at least 8 different assessments that we do just in the initial enrollment process. And that is completed by, and I won't name off all 8, but people like the dietitian, our medical provider, they'll do an assessment, occupational therapy, home health care, or our home care coordinator, she will actually do an assessment as well. So there's all these different people that are working together to make sure that this program is right. So if somebody calls into us, our enrollment specialist, Krista, she will do a real quick, short phone interview with them. And it can be with the individual or it can be with a caregiver.
Okay.
So just a real quick assessment to make sure that they meet the basic stuff, like 55 years or older, they live within our service area, that type of stuff. As long as they pass that, Krista will go out to the home. She'll start the enrollment process. And then the home care coordinator and the occupational therapist will do an in-home assessment.
Okay.
And those 2 individuals do the assessment in the home because that is their environment. We want to make sure it's a safe environment. We want to make sure they have the right medical equipment. And if they don't, then we need to work on getting them the medical equipment that they need.
Is that process kind of similar to, I've seen people that had to go to a nursing home for rehab and they have a kitchen and they want to make sure people can and do things at home.
Yep, and because part of the enrollment process is ensuring that they meet that nursing facility level of care. So that is born out of whether or not there's any sort of adult daily living skills that they need help with. It could be, preparing food in the kitchen. It could be, being able to go to the restroom on their own. Whatever the case may be, just regular daily living skills. So they assess all that. And then from there, then they will continue on with the enrollment process. After we're done with the home assessments, we will ask the individual, if they're capable to come into our facility. We want them to tour our facility. We want to show them what it's like. We want to talk to them more.
Are their family members allowed to come with them?
Yes,
during that
and we
process?
highly encourage that.
Okay.
We want not just the participant to be involved, but we want the family to be involved as well, because generally by this time it's the family that's already taking care of that participant or that individual, their loved one. We want them to know that their loved one will be in a safe environment and receiving the care that they need. So they'll come in, they'll do a tour of the facility, and while they're here, we will complete the other assessments needed for the enrollment process. After all of that is done, and I should say, if transportation is needed, even when they're not a participant, we can still provide that transportation to them.
That's awesome.
We have partnered with Livestream. We're very fortunate to have them on board. So they will be providing all of the transportation for our participants.
So, for instance, if a family member who has been more of the primary caregiver enrolls someone and they're working, so they could have transportation as well for the participant.
Yes, we will bring the participant in. So after they've completed all those assessments, and like I said, I know it's a lengthy process, but we just want to make sure we're covering everything. Once that is done, the interdisciplinary team will get together. They'll discuss a care plan for that participant, and then Krista will take that care plan to the participant's home, or the potential participant, present it to them, and if everything is good, they'll sign off on it, and then we can get them enrolled into the PACE program.
What would happen if a person says, okay, I like 1, 2, 4 and 5. What do we do?
Which will probably happen. But you know, that's one of the things that we encourage here at PACE. We want individuals to take part. So if they have questions, if there's something in their individualized care plan that they don't like necessarily, we will take those concerns back to the interdisciplinary team. We will discuss it with them. Ultimately, at the end of the day, the interdisciplinary team does have to do what they feel is right for the healthcare needs of the individual, but they do take that into consideration, and if they can change it, they will absolutely change it. If not, then we will have that conversation with the potential participant as to why we're not able to change that.
The one thing about PACE, it's all-inclusive care.
Yes.
So, a question that always comes up. So, do I keep my doctor, or do I use the doctors here? How's that work?
So PACE, and I will explain why it's set up the way it is.
Okay.
When an individual wants to become a participant at PACE, they do have to take on the primary care physician that we have here at the PACE Center. The reason for that is because that primary care physician is a part of our interdisciplinary team, and they're the ones that are in constant contact. So we want everything brought together. For a specialist, it's a little bit different. If an individual has a specialist and they are within our area, and you know, care is good, we don't want to rock the boat with that. As long as we can continue that care with that specialist, we're more than happy to do so. If not, if they need a specialist, then obviously we will help them get what they need. But yeah, that is the one drawback, but I don't see it as a drawback because your primary care physician is now part of a larger team, which is more eyes on you, a lot more care, bang for your buck, basically. So
great. And we've discussed it a little, but some of the things that also for all-inclusive care, labs and radiology, that's a big plus, I believe.
There's so many different aspects, and under the PACE model, whatever the healthcare needs truly are for that participant, we will service those.
Okay.
Not everything will be serviced here on site, here at the PACE Center. I do want to say though, we are very pleased to bring basic service such as optometry and dentistry. We'll be able to provide those here on site. And then of course we have physical therapy and occupational therapy and all that. But anything that we cannot provide here on site, we will provide the transportation if needed to that other doctor, that specialist, or to wherever they need to go to receive those services. But we will ensure that everything is taken care of for that individual.
So can you give us an update on the steps to open? Where are we?
So obviously with COVID, that has pushed things back. We weren't able to do a lot of the marketing that we were wanting to, and we've had to push some things back with the state because the state has, they've been worried about other things right now. But I am very happy I'm very pleased to say that we are in the final steps of opening. We're working very closely with the state of Indiana and with the Centers of Medicare and Medicaid. All of our applications and all of that have been submitted. We're just waiting for that final approval. So once we get that approval from the state, we sign what's called a three-way agreement between us, the state of Indiana, and CMS, the Centers for Medicare and Medicaid, and then we will get to open our doors. So we are right there. We're getting so close. And
I'm sure we have a lot of viewers who can't wait for you to open.
Yes, we're getting calls almost every day, it seems like, so very happy.
Another thing is you have partnerships.
Yes.
Can you tell us about some of the partnerships that you have?
So with the PACE program, we're not out to, to step on anybody's toes or anything like that, because for one thing, it's such a narrow gap of individuals that we serve. So what we want to do is we want to build those partnerships with the community, and that's where a lot of my position comes in. I love doing it. I love being out in the community because obviously there's not everything that we can do. So we want those partnerships in place. If there's an individual that needs a service that we can't provide, we want to be able to have that partnership in place so we can get them the services needed. And then vice versa. If there's an agency out there that has an individual that needs certain services that they can't provide, we want to have that opportunity to provide those. So we are looking to build partnerships with just about anybody that would have us. I have another meeting coming up later this week with an area agency We're just continuing to build those partnerships and looking for people that want to just serve the community.
And also referrals. How can a potential participant be referred?
So I will say the easiest way is probably just give us a call. So that number will be out there. For those that need it, it's 765-935-8959. They can give us a call. We will be starting, hopefully, fingers crossed, as long as everything continues to go smoothly, we will be starting enrollment soon, and we will definitely get that out, the word out when that will be once we're able to announce it. But they can give us a call, we can add them to a referral list, or hopefully here pretty soon our website will be up and going. It'll be reidhealth.org/PACE. There will be a referral link on there. And if they're seeing a provider, they can talk to them about coming to the PACE program, and those providers can refer them over as well. So many, many different ways to be referred here to PACE.
Great. Was there anything I possibly missed that you'd like people to know about PACE that we didn't cover?
Well, no, I think we covered a whole lot here, but it really is truly a program that I'm very, very excited about. So with COVID, you have a lot of downtime, and we've been able to do a lot of additional training here at PACE that we're very proud of. And there's certain videos that we've watched, and with individuals that are in the latter stages of their life, and they always talk about they wish they had more time at home, because obviously by that time, they're having to spend a lot of time in facilities, whether it's nursing facilities or in hospitals, things like that. And that's something that the PACE program is able to provide. We're able to provide a lot more time in your own environment as long as it's safe to do so. So we're helping people to stay connected with their loved ones and with their community. So we're very proud to bring this PACE program here to this area. I think it's going to benefit many, many people, and we're truly just looking to serve our community members.
Well, great. Well, thank you for joining us today on Reid Beside You, and we look forward to working with you in the community.
It's good to be here.
And thank you for joining us on Reid Beside You.